If you believe Kegel exercises are only for women, you're missing out on one of the most powerful, free, and natural ways to improve your sexual performance, strengthen erections, last longer during intercourse, and protect your urinary and prostate health. Why men should care about Kegels. Kegel exercises target the pelvic floor muscles, a group of muscles that stretch from your pubic bone to your tailbone. These muscles support your bladder, rectum, and in men, the prostate. For men, pelvic floor muscles are essential for several reasons. Erection strength. These muscles help trap blood in the penis by compressing the deep veins, maintaining firmness. Ejaculation control. Pelvic floor muscles contract during orgasm, and learning to control them can delay climax. Urinary control. They help you start and stop urination, preventing leaks and urgency. Prostate support. A strong pelvic floor can reduce urinary symptoms associated with prostate enlargement and aid recovery after prostate surgery. Whether you're in your 20s or 60s, keeping these muscles strong supports both sexual health and day-to-day function. The science behind Kegels. When you become sexually aroused, your pelvic floor muscles, particularly the bulbocavernosus and ischiocavernosus muscles, contract to maintain penile rigidity. Weakness in these muscles can lead to softer erections, difficulty maintaining an erection, premature ejaculation, urinary dribbling after urination. Evidence shows Kegels work. BJU International, 2005. 40% of men with erectile dysfunction regained normal function after just 3 months of pelvic floor training. Therapeutic advances in urology, 2014. Men with premature ejaculation improved intercourse duration by several minutes with Kegel training. Neurourology and urodynamic studies. Significant improvements in urinary continence were observed after prostate surgery when patients performed pelvic floor exercises regularly. These studies confirm what many men have experienced anecdotally. Stronger pelvic floor muscles improve sexual and urinary health in meaningful ways. Step 1. Finding the right muscles. Before you begin, you need to locate the pelvic floor muscles. Here are 3 easy methods. The urination stop test. While urinating, try to stop or slow the flow midstream. The muscles you contract are your pelvic floor muscles. Use this only for identification, not as a training exercise. Erection lift test. When erect, try to make your penis lift or bounce slightly without moving your hips or abdomen. This engages the same muscles. Sensation cue. Imagine preventing gas from escaping. The squeeze you feel is your pelvic floor at work. Once you can feel and isolate these muscles, you're ready to begin training. Step 2. Mastering proper technique. Proper technique is critical for effectiveness. Get into position. Beginners may start lying down with knees bent to reduce resistance and make contractions easier. Contract. Squeeze the pelvic floor muscles inward and upward, as if stopping urination and preventing gas simultaneously. Hold. Start with 3 to 5 seconds per contraction. Release. Fully relax for the same time before the next repetition. Breathing. Keep breathing normally. Never hold your breath. Avoid. Do not tense your abs, thighs, or buttocks. Tip. Place a hand on your abdomen while performing Kegels. It should remain soft and relaxed. Mastering isolation is key to seeing results. Step 3. Beginner's routine. For beginners, consistency is more important than intensity. Start with slow Kegels. 10 repetitions, hold 5 seconds, relax 5 seconds. Perform 2 to 3 sets daily. Fast Kegels. Quick, firm squeeze for 1 second, relax for 1 second. Do 10 to 15 repetitions, 2 sets daily. Progression. As you build strength, increase hold time to 8 to 10 seconds and aim for 30 to 40 total contractions per day. Even a few minutes a day can produce noticeable improvements within 4 to 6 weeks. Step 4. Advanced training for sexual control. Once you can hold contractions for 10 seconds without strain, you can advance your training. During sexual activity, when you feel close to climax, perform a strong pelvic floor contraction for 3 to 5 seconds to help delay ejaculation. Standing or seated Kegels. Training against gravity increases resistance and challenges the muscles further. Combine with stop-start technique. Pause stimulation, contract the pelvic floor, and resume when sensation subsides. These techniques give men greater control and endurance during sexual activity. Kegels for erectile dysfunction. For mild to moderate erectile dysfunction caused by weak pelvic floor muscles or venous leak, Kegels can help maintain erections. Best results occur when combined with cardiovascular exercise, weight management, blood sugar and blood pressure control, avoiding smoking and excessive alcohol. Additionally, PDE5 inhibitors, like sildenafil or tadalafil, combined with Kegel training, often produce greater improvements than either alone. Kegels for prostate and urinary health. Kegels also benefit men with prostate or bladder issues. BPH, benign prostatic hyperplasia, helps reduce post-void dribbling and improves bladder emptying. Post-prostate surgery enhances continence recovery and reduces leakage. Overactive bladder strengthens control over urgency and reduces accidents. Strengthening the pelvic floor can make daily life more comfortable and reduce embarrassing urinary problems. Common mistakes to avoid. To get the best results and prevent problems. Overtraining. Too many reps can cause muscle fatigue or pelvic pain. Wrong muscles. If thighs, buttocks, or abs are tensing, you're not isolating the pelvic floor. Holding your breath creates unnecessary abdominal pressure. Integrating Kegels into daily life. You don't need extra time to train while brushing your teeth, sitting at red lights, watching TV, or lying in bed. In the shower, small, frequent practice sessions are more effective than occasional intense sessions. Build it into your daily routine and it becomes effortless. When to seek medical advice. Consult a doctor if you notice persistent pelvic pain, blood in urine, ED that doesn't improve after 3 months of training, urinary symptoms worsening instead of improving. You may need a full urological evaluation, hormone testing, or referral to a pelvic floor physical therapist. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss an update. We've got plenty more real talk on men's health coming your way. Thanks for watching, and we'll see you in the next video.